Pursuing the Women's Diagnostic Center as a top priority campaign for One Vision is important right now because there's no better time to address the battle that the community is having with breast cancer. Unfortunately, breast cancer is a very common disease. 1 in 8 women are diagnosed with breast cancer in their lifetime. This is very common, and all women over the age of 40 should be receiving screening mammography. This involves nearly half of the patient population. So expansion of the Women's Diagnostic Center will impact a huge portion of the population. Any donations to the Women's Diagnostic Center will be put to very good use and will help the patient population at whole, and maybe even you. The new Women's Diagnostic Center will be state-of-the-art, second to none, and totally in strategic line with our mission here at Doylestown Health.
Our goal in the Women's Diagnostic Center is to find breast cancer at its earliest phase. We want it to still be contained within the breast. We don't want it to have spread to the lymph nodes or to the rest of the body, which makes it much harder to treat. We saw about 180 breast cancers in 2019. Of those, 2/3 were found on screening mammograms, which shows you the importance of screening mammograms, that we can find these breast cancers. When we find it in its earliest stage, stage 1, then it's usually curable. Our patients are often scared and nervous, and so to have a comforting setting really helps. All of the little things that we can possibly do to make the experience a more positive one is what we're striving for. We've been in the same spot for about 23 or 24 years, and we've more than outgrown it. The new space is double the size. I believe the staff will be thrilled to have their own space and be able to do their work in a quiet environment. The mammography rooms, we only were allowed to have 2. We didn't have any space, but now we're going to be able to have 3 mammography rooms, and we're going to be able to have 3 ultrasound rooms so that we can be able to increase our efficiency, increase the throughput, allow for more patients. We're hoping that our current wait time, which is about 3 weeks for a screening mammogram, will be able to be significantly decreased. We want patients to be able to call and get an appointment within a week. The diagnostic patients, they want to be seen the next day. We want to be able to accommodate them to within 2 to 3 days. It's very anxiety producing to have a problem with your breast. So to be able to get quick discussion of what the problem is and what to do next, that's our goal. We don't want patients out there waiting. So our primary goal is to decrease wait time by increasing the access. We also want to increase the ability for patients to get in and out when they're doing screening and not have to sit for a long time. We are trying to make this a very warm, very cozy space for patients to feel really comfortable in. Community support is essential for us here at Doylestown Health, but especially in the Women's Diagnostic Center. We want to be able to continue to provide the top-notch care despite being a small community hospital. And the community support allows us to do that, allows us to remain at the cutting edge of technology so that we are still able to provide the excellent care that patients in this community deserve. But there's a second reason that we really need the community support, and that's the women themselves. When women come to the center and they are comfortable and they like the atmosphere and the care that they receive, they come back. We have a lot of long-term patients that we see year after year. And that word of mouth then spreads to their neighbor, to their friend. The screening mammogram's not that bad. I just went and had it. It was really pretty easy. You were in and out quick. There's really no reason not to go get that done. So that word of mouth really builds our clientele and really helps us to continue to improve our program.